Hi, I'm Dr. Arti Sharma. I'm an obstetrician and a gynecologist with special interest in cosmetic gynecology and other gynecological problems. I'm practicing in Bangalore, and today we'll be dealing with certain questions revolving around abortion, incomplete abortion, and retained products of conception. So, incomplete abortion is the partial loss of products of conception till 20 weeks of pregnancy. So, the patient usually comes with complaint of bleeding. It will be a heavy bleeding with history of passage of clots, weakness, dizziness, abdominal pain, lower abdominal pain, and sometimes if the incomplete abortion is there for quite some days, then patient might also come with fever, sepsis, chills. So these are signs when patient lands up with severe infection due to retained products. There can be many reasons in fact. The first and the most common is when the product of conception, that is the baby, is not healthy. The baby might be suffering with some chromosomal diseases or some other issues which are incompatible with life, and it's a nature's way to expel whatever is not healthy. Or there's some problem with implantation. That is one cause. Other causes could be some hormonal irregularities. There could be some abnormal uterine shape, or one of the major important issue is your incompetent cervix. So in all these cases, what happens is your uterus is not able to hold the product of conception, and the product of conception ultimately comes out. These are the most common causes. Other causes could be some other general medical problems the female is having, some heart disease, some renal diseases. They can also land up with abortions. Now, a lot of questions revolving around when should a ultrasound be done. Whether you want to continue a pregnancy or you want a termination of pregnancy, the first scan should be as early as maybe 6 weeks to confirm the pregnancy is in the uterine cavity and the pregnancy is healthy or not healthy. It is very important to do an initial ultrasound because you want to rule out ectopic and other conditions revolving around pregnancy. After you decide to not continue with your pregnancy and you go for termination of pregnancy, especially medical termination, then the second scan also becomes important, and that should be done, let's say, around 10 to 14 days after taking your medical termination. Why? Because there might be certain products still left in the uterine cavity even after taking medical termination, even after having bleeding for 4 to 5 days. Almost 3 to 5% cases might land up with surgical evacuation also. So that is why it is very important to repeat a scan after 10 to 14 days to make sure that the entire uterine cavity is empty, or to rule out if there is any product of conception still inside the uterine cavity, and in case you require a surgical evacuation. Well, I always tell my patients that not always, it depends. If the products are very minimal, there is bleeding, then yes, maybe you don't need any medical or a surgical procedure. But if there are too many products in the cavity, the patient is having heavy bleeding, then I don't like to take risk with my patients. And in those cases, I always advise the patient to look for the symptoms, to opt for medical termination or a surgical evacuation. Now, another common question which patient asks, is it always necessary to do a surgical evacuation when I have retained products or when the abortion is incomplete? Well, the answer is no. It's not always necessary. It has to be patient oriented. We have to see what are the signs and symptoms patient is having. If there is excess bleeding, and what our ultrasound report says. If there is too much of collection, there is vascularity in the products which are left behind, then yes, a surgical evacuation becomes absolutely necessary. But sometimes when there is a minimal collection, there is no fever, there is minimal blood loss, then we can ask the patient to go for expectant management, wherein we ask the patient to repeat the scan after 7 days, to watch for bleeding, to watch for fever, to watch for other signs of infection. And after a week, we repeat the scan to see if there is any other retained products left. Sometimes we give medications to aid this process, and sometimes, yes, when there is too much of collection, we go for surgical evacuation as well. Now, a lot of patients ask me that if I'll take medical termination of pregnancy, how will I know that the procedure is a success? So, firstly, I always explain them that what should they expect when they take medicine. There will be some amount of bleeding, there might be some passage of clots also. The bleeding will be as much as they suffer during menses, or maybe little more than that. So, those are the signs when we know that yes, the procedure is effective. But how to be 100% sure is, whenever I give a medical termination to a patient, I ask the patient to come and follow up with me after a week, wherein I ask the patient all her history, how much was the blood loss, is there any sign of fever, any new symptom patient is suffering from, and I get a scan after, let's say, 7 to 10 days to make sure that the uterine cavity is completely empty and the procedure is absolutely a success. What happens if the product of conceptions are remain in the uterus? It can become a life-threatening thing, because if the products are inside, the patient might land up with heavy amount of bleeding. The patient can lose a lot of blood, and sometimes if bleeding is not there, then the patient can land up with severe sepsis, and that again becomes a life-threatening problem. So the female should be aware of the fact that what are the signs when she should be coming to the hospital. If there is excess bleeding, there is fever, there is abdominal pain, the bleeding is continuing for many days, then she should be visiting a doctor, because these are signs that her abortion is not complete and some intervention is required to evacuate the entire products of conception and to complete the process of abortion. So this was a small part of me trying to increase the awareness regarding certain cosmetic gynecological procedures and other gynecological issues. If you like this video and if you want to know more about certain topics, then please let us know. I will try my best to increase the awareness. And of course, if you like the video, click on the like button and do share our videos. Thank you.